guys. Okay, let's do week 9. It's almost the end. Yes. Okay, so I'm going to cover 2 chapters, chapter 28 and chapter 90. It both concerns the male reproductive system and the disorders associated with it. So, starting on page 325. Boom. I'm going to fly through these, okay? So, I say that every time. I really am going to try this time. So, page 325, chapter 28, the male reproductive system. Basically, structure and function. The organs of the male reproductive system produce and transport sperm, and man's reproductive capacity is directly associated with sexual excitement, penile erection, and ejaculation. The male reproductive system consists of the testes, where they produce sperm, ductal system and seminal vesicles, where they transport and store the sperm, the scrotum, which holds the testes and regulates their temperature, the penis, which deposits the sperm in the female, and accessory glands produce male hormones and other secretions. The area between the scrotum and the anus is the male perineum. If you know this, you basically know this chapter, okay? So I'm going to fly through the other things. So again, we have the testes is where it's produced, they're made, blah, blah, blah. Then you have the ductal system is where things are just kind of then like shooting. And then you have the epididymis, which is the long coma-shaped organ attached to the posterior surface of the testes that stores the sperm cells. And then you have the ductus deferens. Basically, it's the vas deferens, which is the carrying away vessels. So that's where they're taken away. And that's basically it. It's really fast, but that's all you really need to know. The key concept, the 2 vas deferens or ductus deferentia are ligated or tied and cut in the male sterilization procedure called the vasectomy. This operation does not affect erection or ejaculation. It prevents sperm from passing. However, it is not 100% proof or not 100% effective, so you could still get pregnant. So, surprise! Okay, so then you have different ejaculatory ducts because you need to propel those sperm in there to get that woman pregnant, to get the reproductive system, whatever, blah, blah, blah. Anyway, though, scrotum. So that's basically where you have the sac that holds the testes, which is where the magic happens. So, however, though, it's kind of neat. The scrotum regulates the temperature of the testes. The cremasteric muscles involuntarily contract and tighten the spermatic cord to bring the testicles closer to the body or away, depending on temperature. The temperature of the testes is about 35 to 95 degrees, 35 degrees Celsius, 95 degrees Fahrenheit, which is lower than the internal body temperature, which is 37 degrees Celsius and 98.6 degrees Fahrenheit. So if it gets too hot, you're not going to have anything produced. Got to keep them cool. So it's really important to keep them breathable, so no tight-fitting clothes, keep them cooler, and then just eat well. Zinc is super important for the whole reproductive health of the human body. So let's see here, then it talks about that. Okay, so penis. So it contains smooth muscle, connective tissue, and blood sinuses. So large vascular channels. So basically, when it's go time, it fills up with blood, and it's gonna get the job done is the goal. So, but it can be damaged. So be careful because I think it talks about it a little later on. Anyways, though, it can bend. And I think I do talk about that later. So, key concept, page 327, the route of sperm. If you know this, then you know the reproductive system, then you're good. You got the testes, the epididymis, the ductus deferens, and then the seminal vesicle, the ejaculatory duct, and then the inguinal canal, the urethra, and then boom, outside. So, let's see here. So basically, there's an involuntary sphincter at the base of the bladder and prostate gland that automatically inhibits voiding during semen ejaculation. So that urethral gland has 2 purposes, to void and to eject sperm, but it's inhibited depending on which function is going. Okay, so I'm flying through this. Then you have then you have different things. The prostate is a donut-shaped muscular structure that's about the size of a walnut that lies below the bladder and surrounds the neck of the urethra, and we'll talk more problems about that later on. Prostate's a big thing these days. NCLEX alert, know the normal and abnormal conditions of the reproductive system. Then you have what's called the bulbourethral glands. So this bad boy is around, let me see here, It's around the prostate, which secretes alkaline mucus, so alkaline, because the woman's vagina is very acidic due to its normal flora. So the alkalinity of seminal fluid helps neutralize the acidity, vaginal pH, and maintain sperm motility and viability, because the ultimate goal of these two things is to get the woman pregnant. So the better chances, then the better likelihood. Okay, so then there's tons of hormonal influences. Just know though, when a boy reaches puberty, the hypothalamus is which stimulates the secretion of hormones. So on page 328, they stimulate the gonads, the sex glands, to secrete specific male hormones or androgens. And then FSH, follicle stimulating hormones, stimulates the formation of sperm. The major androgen, male hormone, is testosterone. Its production is stimulated by the interstitial cell stimulating hormone, ICSH. As long as you know they got testosterone, that's what's going on. Testosterone also maintains the functioning of male accessory organs and stimulates protein anabolism. As a result, a man usually has larger and stronger musculature than a woman. So, men have testosterone, women have estrogen, but there's different little things in each hormone. Hormones, I'm telling you, they govern the entire body. So this key concept here talks about if they get testosterone replacement therapy. If they do, then the testes will tend to shrink because they're like, oh, we don't need it because we have an overproduction of testosterone, so you can just kind of go away. Okay, so then we're going to talk about what is the sperm cell and spermatogenesis. So sperm cells develop from stem cells. Spermatogenia. A mother cell helps create spermatogonia, and a specific cell, the Sertoli cell, facilitates spermatogenesis. Spermatogenia divided by mitosis and then meiosis to form spermatocytes. In the next stage, the cells are spermatids, which eventually develop into spermatozoa. A total process requiring about 2 months. So the formation of a sperm is about 2 months for it to mature. However, it can produce millions and millions and millions of these guys. So the ejaculatory fluid contains about 60 to 100 million sperm cells per milliliter. That is crazy. Whereas we have one egg once a month. So let's see here. So sperm cells are highly specialized. So the testes produce millions of spermatozoa each day, and they are stored in the ductus deferens. The sperm cells are highly specialized and have several divisions. So the head of the sperm contains the 23 chromosomes, and the tip of the head, the acrosome, contains enzymes that can dissolve the tough cell wall of the ovum, which is the female sex cell, which is a little egg. The body center sections contain mitochondria, the energy, providing energy for locomotion. The whip-like tail is a flagellum that propels the sperm with a lashing motion. So, test question. How long can sperm survive inside the female? This book says up to 3 days, but new scientific evidence is saying up to 8 days. But for the test question, just know it's 3 days. 1, 2, 3. Let's see here. So of the average 250 million sperm cells ejaculated, only about 100 survive to contact the ovum and the oviduct, although usually only one sperm fertilizes the ovum. Basically, you being alive today is like a freaking miracle because of like everything that's going for it, and then boom, like one out of those 250 million will survive. Wow. Okay, so then the book talks about copulation. We all know how the birds and the bees are, but just know some definitions is that the inability to achieve erection is called impotence, and difficulty in achieving orgasm is called anorgasmia, and then low sperm count is called oligospermia. So yeah, and then it just talks about the effects of aging on the male reproductive system. Just know the biggest thing that goes with that is the enlargement of the prostate gland, and it has a nice table there on page 329. I love the tables in this book. If you know the tables, you know the key concepts, you pretty much know the chapter. Okay, so that is pretty much it. So now we're going to skip to chapter 90 and talk about the disorders, and I'm going to fly through this bad boy. Okay, so chapter 90, page 1646. So, blah, 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 blah. So we have what's called the prostate-specific antigen, the PSA. It's a blood test that detects a glycoprotein found only in the tissue of the prostate gland. PSA can be elevated in prostatitis, benign prostate hyperplasia, and malignant prostatic tissue, as well as metastatic prostate cancer. So the PSA is a big guy when it comes to male health, when they're testing for things like that. So also know this, to avoid falsely elevated PSA levels, collect the blood sample either before the digital prostate exam or at least 48 hours after the exam. So basically any like trauma down there is going to make the test like it's not going to be an accurate test. So the digital exam, we're going to talk about it later, but it's like a, okay. Let's see here. So blah, 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 blah. And then it talks about a prostate gland biopsy. So it's the needle excision of a prostate tissue specimen for histologic examination. It's often performed to diagnose prostate cancer after suspicious rectal examination. It may be performed via 3 possible approaches. Perineal, which is that skin dividing the anus to like the other part. And then you have the transrectal, which goes right through the anus, the rectum, or transurethral, which will go through the urethral gland to get to the little prostate right there. So another type of prostatic biopsy is performed through endoscopy. The endoscope is inserted through the urethra to the prostate where a small tissue sample is removed. Okay, so then like blah, 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 blah. So key concept. The client may be embarrassed and concerned about any disorder related to the reproductive system. He may see the disorder as a threat to his manhood. Female nurses should be especially conscious of such concerns and be sensitive to the client's feelings. That is especially true in teenage boys. If you can have male nurses go in there and talk to them, they feel much more comfortable, and vice versa. If you have a teenage female and there's a male nurse talking to her about all that's going on down there, get a female nurse in there. Basically, what's the most success your client will have? If it's unavoidable, then just work with what you got. But just think about, like, for me, I would want a female, you know, versus like other people probably won't care and other people want the other way. So just kind of go with what your patient is going to want / need / the better care for them. Anyways, okay, so then it talks about blah, 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 erectile disorders. And there's a nice box 90, 90-1 on page 1648, factors contributing to erectile dysfunction. Talk about use of tobacco, hormones, drugs, chronic diseases, endocrine disorders, trauma, heart issues, surgery. Okay, that's good stuff to know. Basically, so the penis is a very vascular organ. So, organ, blah, blah, blah. Anyways, it's a very vascular structure. So any sort of inhibition of blood flow is going to cause any sort of erectile dysfunction. So fixing that is the goal. Basically, a very vegetable pro diet and beets, B-E-E-T-S, beets are amazing for blood flow. So if you ever have any problems or if you know anybody that does, beets are the way to go. Okay, so and then it also talks about oral medications that will help with the forming of an erection. Viagra is a big one that everybody knows about, but just be careful that these medications are vasodilators, so taken in pill form that help the penis to fill with blood. They must be taken with caution because of possible systemic side effects. So medications used to treat ED, for example, Viagra, are contraindicated for clients who use nitroglycerin products. Life-threatening hypotension may result because nitroglycerin already lowers your blood pressure. And then with these guys, with the blood flow going directly to that structure, it's going to decrease the other blood flow everywhere else, causing you to be super dizzy. So be really careful. Okay, I'm going to skip to priapism on page 1649. So priapism refers to the abnormal and persistent penile erection without sexual stimulation. It is extremely painful and may last several hours or even days. The client must seek immediate medical attention. The causes include maybe a spinal cord injury, a tumor, or cerebrospinal syphilis. Also leukemia, sickle cell anemia, or other blood disorders may cause it. The signs and symptoms, basically a chronic erection. And then the medical and surgical treatment. So the goal is to improve the venous drainage of the corpora cavernosa, as part of the penis, while preventing ischemia that may result in impotence. So if you leave it for too long, it could cause severe damage and it can never have another erection. So injection of a solution of phenylephrine into the corpora cavernosa may reverse priapism. Let's see here, and they also may just drain it with a butterfly needle, and spinal anesthesia may relieve priapism, all that kind of stuff. So basically, if you know somebody that's had it for more than at least 3 to 4 hours, I think is the recommendation, go get seen. Go get it taken care of. Don't let it just like sit there, because it'll be worse later on. Okay, and then so I'm gonna skip to Peyronie disease. Peyronie, sorry, I don't really know how to say that. It's an accumulation of plaque or scar tissue along the corpora cavernosa, causing a painful curvature of the penis when erect. So that can be just like a slowly bend versus like an actual like trauma can actually like make it bent, which isn't very fun. Okay, so the plaque or scar tissue may be removed by surgery. Great. Okay, so the NCLEX alert basically says, know the lab values, know the structures, and know how like that is. As long as you know like generally like the anatomy, you can break things down. And if you know kind of like which like medical terminology means which, then you can also break it down, which is really nice, which will make you more successful. Okay, so structural disorders. So just know that undescended testicles are called cryptochordism. So this may be a unilateral or bilateral condition. Although it is unusual for both testes to be undescended, sometimes the testicles descend without treatment. If this does not occur, they should be correctly positioned early in life to allow for successful sperm production, because internal body temperature is too warm for the development of viable sperm. So basically, when you're doing your head to toe assessments and you just kind of notice that like that doesn't look very within normal limits, bring it up to the provider, bring it up to the parents, have a big discussion about it, because you want the most success for every person in life. Okay, so abnormal urethral placement. So you have what's called hypospadus. So this is the underside of the penis where the urethra is showing, and then epispadus is the upper surface of that, and it's congenital. They're born with it. Page 1650 has 2 pictures of it, which is a great showing of it. So let me see here. Usually it's repaired surgically at a young age if they are severe. Testicular torsion. That's a big emergency. Is caused by the twisting of the spermatic cord, resulting in interruption of blood flow to the testicle, which could cause necrosis, which could cause them to have to get that removed. It's fixed surgically. They're going to have pain. They're going to be like vomiting. And a lot of the time it's from usually teenagers get it from excessive exercise or some sort of sudden pulling or just something like that. And they're usually embarrassed to tell their parents or anybody about it. And it can go on all day, which is really bad. So educate your teenagers, this could happen, this is a possibility. Don't be embarrassed to talk about it. Get it taken care of, because it will save you later down the road. Because if you don't have a testy, then you have to get it removed, and then you only have one testy to possibly get pregnant in the future, or just to your own self-image. It's a big deal. And self-confidence. Okay, so a varicocele. Okay, varicocele is an abnormal dilation of the testicular veins in the scrotum, causing a reflux of blood down to the scrotum when standing or straining. So basically it's just a lot of blood going down there. And so signs and symptoms, the veins become dilated and tortuous, and on palpation are often described as similar to a bag of worms. A varicocele may be unilateral or bilateral. However, this condition is more commonly seen on the left side. This is probably because the left spermatic vein is longer than the right. So just know it's kind of, it's like varicose veins in the scrotum. That's a kind of a way you could think about it. Okay, so surgical treatment is usually done surgically. So correction is done surgically. Great. Then you have what's called a hydrocele. It's an accumulation of fluid in the space between the membrane covering the testicle and the testicle itself. It may be caused by infection or an injury. The scrotum enlarges, pain and swelling may be present. However, the client with a hydrocele is often asymptomatic. They don't know they have it. Hydrocele may be treated by aspirating the fluid. Let's see here. So there's a picture on page 1651. Kind of just happens. So usually the symptomatic treatment includes applying cold packs, providing support for the scrotum, and providing emotional reassurance that the condition will resolve and will not affect future fertility. So when they say support for the scrotum, they usually will take, a lot of the time, we'll take a pillowcase. And so let's just say, so the male patient is sitting down and in a chair, for example, in the Fowler position, and they put a pillowcase in between his leg, and then they cup the scrotum, and then the pillowcase after that. That kind of provides that support for that swelling down there. So it's not hanging and causing so much strain on that skin. So you have that support there. So they use a pillowcase. If that makes any sense. Okay, inflammatory disorders. The epididymitis is an inflammation of the epididymis, which is the coiled tube at the posterior of the testicle that stores and carries sperm. So it's the inflammation of that tube right there. It is most often caused by bacterial infections due to STDs such as gonorrhea, syphilis, or chlamydia. So for boys or men who are not sexually active, the source of the problem is usually related to an infection spread from the urinary tract or the prostate gland or the seminal vesicles. So it could be another route of infection. So the symptoms of this include redness, pain, unilateral scrotal swelling, dysuria, which is painful urination, blood in the semen, enlarged lymph nodes in the groin, and pain in the lower abdomen and pelvic area are also seen. And then it talks about a little bit more. So the diagnosis usually includes a physical examination, including a check of the prostate gland, enlarged lymph nodes of the groin, and unilateral enlargement of the testicle. The treatment will include a culture and sensitivity of any penile drainage, administer antibiotics and analgesics as ordered, provide scrotal support, and apply cold packs to the scrotum. Antibiotic therapy usually continues for 3 months or longer, depending. So just know it's an infection, we gotta treat it. Okay, so then you have orchitis. It's the inflammation of the testes, may result from infection or injury. Mumps is a big thing with that. It can cause overheating, so just if you have a patient that has mumps, be really careful with that. Usually vaccinations include that vaccine for mumps nowadays. So symptoms of this include pain and swelling in the scrotum, and sometimes urethral irritation. A scrotal support is used, an ice bag is applied, and heat is not used. Most of the time, you don't put any heat down there unless you really feel like the patient would benefit, but they're usually not because it just causes damage. Okay, so prostatitis. I'm having a hard time speaking these words today. Is characterized by pain, swelling, and inflammation of the prostate gland. The gland is usually the size of a walnut. Let's see here, and then blah, blah, blah. It's usually seen in men younger than 50 years of age. Prostatitis can be classified as acute bacterial, chronic abacterial, and then also known as a chronic pelvic pain syndrome and asymptomatic inflammatory. And the next page has a nice list about all those things. Basically, just know that the nursing considerations are the measures for the client with prostatitis include pain control and warm compresses or sitz bath. Remind the client to increase fluid intake to flush bacteria out of the bladder. Stool softeners help prevent constipation. That's all I really know. Okay, so neoplasms. So benign prostatic hyperplasia. So BPH, or prostate gland enlargement, is a common condition that occurs as men age. The gland begins to grow at adolescence, continuing to enlarge with advancing age. So because of the longevity of men nowadays, the incidence of BPH is rising. So untreated BPH can occlude the flow of urine out of the bladder, resulting in a variety of renal problems. So again, it's that donut shaped. You have the urethra. As it gets bigger, it's gonna just start crushing that, so that one part of the hose out of the body is just causing constant constriction, so you can't really pee very well. So you're gonna have signs and symptoms include urinary retention. You can't pee. Nocturia, you're peeing all the time, you're peeing at night, because it's just that constant flow, because you can't empty the bladder, so it's just causing the that to constrict, so your bladder's not being emptied all the time, so it's causing that need to have to pee all the time. And then straining, where you're really trying to pee. So diagnostic tests, again, it includes the PSA, that prostate specific antigen, but also what's called a digital rectal examination. Page 1653 shows a picture of it. They go through the rectum to feel, because that's where you can kind of feel the prostate is right there in that perineum area, and they can feel if it's enlarged. And then if they're gonna do that, get all the blood work before that though, because that can make the test inaccurate. So, and also, let's see here, the general laboratory tests are ordered. For the example, a CBC, a UA, blood chemistries. A BPH will show changes in the urinalysis, urine culture, serum creatinine, and blood urine nitrogen. So the test related to prostate issues is the test that measures the PSA, the protein produced by the cells of the prostates. PSA levels increase when the prostate is enlarged, or the prostate area has had recent urologic procedures. An infection, surgery, or prostate cancer will also show an increase in that level. But just know if nothing's been affected by it, you take the blood test and it's increased, usually means the prostate's enlarged. So medical and surgical treatments. Some medications can shrink it, such as finasteride. That's a big one that you're going to see all the time. They even give that to people that have a kidney stone because it kind of helps enlarge the urethra, so it helps get that kidney stone through. But you may not even see the effects of this medication for up to 6 months. They also have different surgical treatments, and there's a whole list over here, but the main one you're going to see and hear of is called a TURP, which is the transurethral resection of the prostate. That's the standard surgical treatment for it. So that with the TURP, the surgeon removes most of the prostate gland. And then let's see here. So basically with the transurethral prostate resection is they're going to go right through the urethra and then get that prostate. However, it has major complications such as erectile dysfunction, so you may never be able to have sexual intercourse again. It's a big deal. Let's see here. Then you have cancer of the prostate. Prostate cancer is almost always an adenocarcinoma, a gland cell cancer that is fairly common in men, especially African American men. Most cancers grow slowly, initially beginning confined to the gland itself, and need little, if any, treatment. However, some can be super aggressive. So risk factors, there's a whole list of them, but a lot of time it's age and hormones and lifestyle. Signs and symptoms. The first signs of prostatic cancer, if any, typically involve difficulty in voiding. So whenever you have a patient that says, yeah, I'm having a hard time voiding, investigate that right away, because that's not a normal thing. There's a whole list here that also goes with it, just basically difficulty voiding. So prostate cancer commonly metastasizes to the bones, lymph nodes, brain, and lungs. So just a heads up if it starts to spread. Diagnostic tests involve a DRE and a PSA, digital rectal exam, and then the prostate-specific antigen. So treatment options, treatment may lead to, so a lot of time it's surgical, which may lead to the impotence, or like you just can't, yeah. Let's see here. So prostate surgery, so preoperative nursing considerations, just talk to them about it, make sure they thoroughly understand the complications associated with any sort of surgery down there, because if they never can have intercourse again with their partner, it is a huge life-changing thing. So let's see here. They also may have a suprapubic catheter placed, which is a catheter like right through the abdomen into the bladder, or they're going to have a continuous bladder irrigation for about 2 to 3 days after surgery. So then you have the TURP. Another complication of the TURP is hemorrhaging, urinary retention, or stress incontinence. So they have to like relearn, like they have to practice their Kegel exercises to relearn how to like hold their urine in. So then you have what's called a prostatectomy, which is the removal of the prostate, and it can happen in different ways, but we'll just go with the TURP. Let's see here. Then you also have what's called cryosurgery, is where they just freeze it and they go through the perineum and freeze it, and then that kind of helps with that. Then you have post-operative nursing considerations. So the client will require routine post-op care, such as anti-embolism stockings, early ambulation, and incentive spirometry. Encourage fluid intake and monitor intake and output. Give stool softeners as ordered. Help the client and his partner deal with any psychological and emotional problems. Super important. You're a nurse. You got to be there physically, emotionally, spiritually, everything. So a lot of the time, they're going to place what's called a triple lumen catheter. So the next page, page 1656, has a lovely picture of what that is. So triple lumen, right? One is for the balloon that inflates inside the Foley to keep it in place in the bladder. The other one is the exit point where urine is going to go out. And the other one is a giant bag of irrigating fluid that's going to be flowing down into that catheter that goes inside the catheter, into the bladder, helps flush it out, and then it comes right back out that other lumen, okay? So that's kind of what the goal is. And the goal is to simply keep that bladder from forming too many clots, to just keep it irrigated. Continuous bladder irrigation. Keep the urine clear. Initially after surgery, you are going to see some bleeding, and that's normal, and it's probably normal for like the first night or so, depending on the patient and all the other comorbidities that go with it. However, if you see bright red blood or sudden pain or anything abnormal, not normal. And then so that's really important to continuously monitor the amount going in, the amount going out, and the color and everything that goes with it. So chart. And be super like on basis with the surgeon and let them know exactly what's going on if something is abnormal. They will want to know, and they might be annoyed at first with how much you're calling, but it's your patient's life and it's your license, so don't care what they have to say. Take care of your patient. Okay, so let's see here. Talk to them about Kegel exercises. Painful bladder spasms are common after a client has had a prostate surgery, so antispasmatics are administered to control the pain. Okay, so I'm gonna jump to testicular cancer. Big thing. Testicular cancer occurs in the testicles, also known as the testes, which are inside the scrotal sac. The testicles produce androgens, such as testosterone. Testicular cancer is the most common form of cancer in young Caucasian males between 15 and 35 years of age. The testicular cancer grows rapidly and can often metastasize before diagnosis. It's a big deal, like it happens. So symptoms appear gradually. A painless mass or lump develops as the testes enlarges. A sudden collection of fluid is noted in the scrotum and a feeling of scrotal heaviness occurs. So they might feel a dull ache in their abdomen or groin and have pain in testicular or the scrotum. I actually knew a guy from college who like had this and everything. And then so a lot of the time though, they'll do a surgical removal of the affected testicle, and then or they can do chemo and radiation. And if that's the case, they might want to do like semen banking in case they want to have children in the future. Even if they think they don't, just say it never hurts just to keep some for the future, just in case, because you can always throw it away. You can't always get it back. So that's really important to talk to them about that too. And if they only have one, then they still have a chance. Okay, so then there's also what's called cancer of the penis. Super rare. I have never seen it. I've never heard of anyone having it, but it's out there. So just know that the human papillomavirus, HPV, has been implicated in cancer of the cervix. It also increases the risk of penile carcinoma, so that can happen. So just know that the color of the penis may change. A reddish rash can be seen beneath the foreskin, and the penile skin can become thicker. So nursing considerations for a man with penile cancer include his concerns for sexual activity and his ability to have children. Coping strategies such as support from a partner or wife in groups that have mutually beneficial discussions are helpful. So early treatment is essential. Fear of his diagnosis may interfere with acceptance of this disorder. So it can happen and you never know. And then on page 1658 is the how you do a self-testicular examination. Just do it like once a week in the shower just to make sure everything's normal, once a month, whatever like floats your boat. And in lab, you're going to learn how to do this. Okay, so that was a really quick like run through of this. If you have any questions, you know how to get a hold of me, but that's basically what I want you to know. Okay, thanks you guys.